Welcome to the Shrink Show.
Human. Okay. So we have a fun live guest today, Leslie Koenig, Dr. Leslie Koenig, doctors. She is here. I was trying to go through the logistics with Angie ahead of time. I give her the Spark Notes because my ADHD co-host. So I'm like, Spark Notes. So she's a veteran. She's an ER doctor, and she is soon to be opening a ketamine clinic here in Omaha, Nebraska on September the 18th.
I remember because it's like the second or third time I've heard that specific date. I don't know. It's a Monday. It is, right?
Yeah.
Mm-hmm. I don't know. Maybe there's something in the stars in the day and the linings.
Ooh, very nice. Well, so I don't know where full circle to even begin, but
So we're all doped out on ketamine right now.
wow, so we're very chill.
I know you guys are getting, but I got my squishy mug.
Yeah.
So I think probably a good place to start would be like, what is ketamine? What is ketamine? Yeah, like for people who don't necessarily know anything about it, like Cliff's Notes version.
Well, and most listeners, we are mental health, all in the mental health field, and so most listeners are not. So yeah, we're talking to them like they're 5.
Okay, no offense.
But we love you guys.
You guys are incredibly intelligent. I told someone to talk to me like I was a 5-year-old today. So because they were just like insurance, like I just don't understand. So I literally said, talk to me like a 5-year-old. So I'm in the same boat. Yeah. There's a certain language that people use when they know what they're talking about. Like social work and mental health, it's acronyms. Everything's an acronym. Nobody knows what that means. Yeah. So yes, 100%. All right, ketamine.
Yeah. So what is ketamine?
So ketamine is a medicine that is traditionally used as an anesthetic, and it's been around for decades. Every hospital uses it, and as an emergency doctor, I have used it to sedate patients, primarily kids, to be honest, and for different procedures. So like the other day in the ER, I had a kid who cut his hand, but he's 3 years old, doesn't understand what I'm doing. So I gave him some ketamine so that he could chill out enough so that I could take care of him. So basically, it has always been used in that way. Now we're finding out that at different doses than what we do for procedures, it works to treat depression. Those are journey. I know, because here's where the fascinating part of this to me is it feels very similar to caffeine with somebody who has ADHD. Like that same, because it doesn't make sense to give a downer to somebody who's down. Yeah. But caffeine with somebody who has ADHD doesn't affect them in the same way that it affects a non-ADHD person. I can drink caffeine at 8:00 at night and fall asleep right away. Oh, sure. Yeah. Whereas somebody else could drink that same amount of caffeine and they're wired for 4 hours. That is super interesting. I never thought of it that way. So interesting. Because it's a downer, right? Ketamine, well, it's a dissociative anesthetic. So what it does it just make them forget about their depression? So, I mean, I could be out. I could so be out on like legit how. Yeah, and I just forgot I was. No, not at all.
My only insight is I told Angie, I've had 2 clients, but one client worked with me pretty long term, and they did like a full chunk of time on ketamine and would describe their experience. And so the whole time too, I was like, tell me more. I don't understand what's happening.
Yeah.
Because I don't work in medicine. And so explain just for a patient what their experience is like in the ketamine treatments.
Let's see. So for a patient, it's going to be like a dreamlike state. So it's kind of like you ideally, and I'm an infusion, by the way. There's different ways to give ketamine. I'm going to do the IV version in the vein, because that is 100% available, as opposed to all the other things where you don't really get what you're paying for. So if you hear any other way to do it, you're only getting like a percentage or a fraction of what they're giving you. So are they also getting hydrated? Like, is it, there's a little bit of hydration in there. Yeah. I don't know if it was like a giant bag with just, how they squirt in a little bit of the vitamin or whatever when you do the. Yeah. Well, I don't know. So magnesium is one thing that, if I could get off on my tongue, I love saying magnesium. It is. And when I take it, I feel so much better. Oh my God, we could get on magnesium. How on it? Magnesium's incredible. Yeah, well, and magnesium L3A, by the way. So got the book. Damn. But that's if you're taking the pill form of magnesium. If you're taking that through the vein, then it's what I'm, because the thing is, magnesium actually helps ketamine bind to its receptor in the brain. So that's actually why ketamine is so different than literally every other drug out there, or any medicine. So, like people who have depression, you go to your doctor, you're told, here's a pill, right? And then you don't know when you're going to stop taking this pill. Maybe you'll feel better, maybe you won't. You'll probably have a bunch of side effects. And by the way, fine, you can just deal with those side effects, but you won't be depressed. So yay. Or you will, as one of those side effects is you could experience suicidal ideation. Right? Right. It's scary how the pill that's supposed to help me could literally make me feel worse. Ketamine is the exact opposite. Ketamine is actually a treatment for suicidality. In the ER, we're using it more and more, and I'm actually introducing it into my department as a treatment for people who are qualified, as for immediate, within hours, suicidal drops. And I've done it before in the ER, and a patient went from suicidal to, actually, I have clarity, I have a plan, I'm good to go. I talked to the family within hours.
Really? And there's no, just fun fact for listener, like there is no antidepressant that will do that. Like I will always teach my clients when they're about to or starting, I'm like, not all psychiatrists go through it. So I'm like, just fun fact, if you start this, you're likely going to need a solid like 6 to 9 weeks for it to fully acclimate into your system to even know if it works. And you are more than likely going to need an increased dosage after that 6 to 9 weeks. So it's just such a long waiting game of like, I'm taking this pill in hopes that like months later it magically decreases these symptoms.
Okay, but what about like for that patient, for example, sustainability? So the patient felt great. Awesome. Is that like a permanent greatness? Is that like they're going to come crashing down? Because I feel great when I'm drunk. I think I'm unstoppable about it. But there's always like that crash or that, oh my God, what did I do? Oh no. No. So the thing about ketamine that's different than everything else is it's kind of like a growth factor for your brain. It's the only medicine that will, what we call neuroplasticity. Yeah. So nothing else does that. Ketamine does. It binds completely different in the brain. Most of the ones out there are in kind of like the primitive brain. Mm-hmm. And what we're finding about depression is maybe it is in a completely different part of the brain. Well, it seems like here, the frontal cortex. Exactly. Because you're overthinking everything. Yes. And that's exactly where ketamine works, in the NMDA receptor. So, and then I could turn me down. I love it. I'm like, I'm calling a lot. Oh my God, I'll geek out first. I'll totally geek out. Okay. So ketamine is an NMDA receptor antagonist. Yeah. And so when it binds to that, and it does it in a very specific way, and magnesium is a little bit part of that, which is why we're talking magnesium. Anyway, so what it does is it creates all these downstream effects once it binds there, because it actually binds specifically to the inhibitory neurons. But it makes the excitatory neurons like go more, and usually those only activate in the presence of glutamate. So it kind of creates a condition where it's like you're actively learning something. And that's why it starts to relay these new neural pathways, or helps you relay these new neural pathways, create new habits for the later. So yeah, and actually, when we look at the data and the research, it does this through a couple different mechanisms. The big ones are BDNF, or brain-derived neurotrophic factor. So BDNF is kind of like big in the whole like longevity medicine world, because exercise actually increases your BDNF. Now, shit, are you saying I should exercise? Oh my damn it! But anyway, what it does is actually when you take it, for example, in mice, we see you don't grow brain cells, but you can grow new connections. And this directly makes new spindles, those connections between the dendrites, or like those connections in the brain. It literally makes those grow. I'm so proud of myself that I actually know most of the words that you're saying. I'm just like dendrites. Yep. Remember having to answer that question. Well, yep.
In the brain there. You go. Look at the
dendrite. So that's why it's so different. There's no crash, because it's a little bit like a gym session for your brain, where it's like,
it's relearning how to function.
Mm-hmm. So when you I don't know if I'm jumping ahead, so stop me if you want to go back, or if you just want to bounce all over. I'm totally all for it. I have ADHD. But where I'm at with this is, okay, so let's say somebody comes in with depression. I'm also, another thought I have is, how can this be used with people who have experienced trauma to relearn and reprocess their past and their history and see themselves differently? Oh, beautiful. Okay. But somebody comes in with depression, so they take the ketamine treatment. Is that paired with some sort of therapeutic alignment, therapeutic treatment? Now they have the life jacket and they're not drowning anymore. Who's teaching them how to swim at the same time while this is working?
Yeah, that is an awesome question. And what I want to do is have what we call a collaborative care model, where I want everybody to come through our doors to have an intention, to have a therapist or coach or someone behind them to help them integrate post. Because that is how you help create those neural pathways and to really strengthen them. Because it's a bit like, going to the gym, but then you want to have the proper nutrition. You can't just go to the gym and then not eat for days and days and days and expect results.
Or you can't go to the gym and have no idea how to use any of the machine.
Right. Yeah.
And expect to have the results that you want.
Yeah. Yeah. So you do the ketamine, and there's a wellness period for a while where, say, for example, you guys are trying to get this point across with a patient. Right. You're like, okay, let's just focus on X, and the patient just can't really quite get there. They can't just see what you're saying. But what ketamine does is it really opens up that what you're saying lands. And so that way you can really make huge strides with the right person guiding you. So exactly what you're saying.
Yes.
And, can you do where you do ketamine and nothing else? Yeah, but you're going to grow these neural connections and you're not going to know what to do with it, really. And you may just go back to your old habits and feel better and maybe have a little bit, but you're going to have 50% improvement, 60% versus the 80 to 90 plus you can get with the right person helping you.
So it's like a diet pill versus actually working with a personal trainer who can create sustainable change.
Right.
Diet pill, you can't sustain.
Right. Yeah. It only works. Mm-hmm. Yeah, and that's why ketamine, for 100 people to come into the clinic with depression, about 80% will respond to the treatment, have some improvement in there.
That's pretty high.
Yeah, compared to antidepressant statistic, right, which is what, 40%? It's not.
Well, especially with kids. I'm wondering if this is a thing with kids, because I feel like the antidepressants with children, that's the hardest, because
I've never seen any work with a child.
No,
There's nothing that works.
They don't, and it's scary to take those,
these are adult psychotropic meds.
Right.
That's scary.
So is this something that works for kids?
So there is research out there down to age 13.
That's huge, though.
It's huge.
That's kidding, because I don't feel like you see a lot of, I'm not saying it isn't possible, but you don't feel like you see a ton of depression diagnoses before that age. It's trauma. Yeah, it is acting out. It's ODD. Oppositional defiant disorder, conduct disorder, all that stuff.
Yeah.
Mm-hmm. God, depression is really where it hit me in teen years. That was a rough time.
Yeah. Yeah. And it's so the studies I've seen in the 13 to 18-year-olds, that's actually where some of the suicidality really, where they first picked up, from what I can see from the research. And this research has come in most out of Yale, from what I've seen. Yale, Stanford place. God, I love Yale. Yeah, I know. They had this amazing, actually I got to talk to some of the researchers at a conference. And John Crystal was the big one that I was totally fangirling over him. I was like, oh my gosh, I'm excited to meet you. So, but his presentation was just, oh my God, it was everything. So,
that's a huge age range, especially now post-COVID.
Mm-hmm.
Having something, because I worked at a behavioral school recently. I have no job now. I know, I have whatever. I'm figuring it out. But I worked at a behavioral school, and a lot of these kids, 99% of them experience trauma. And their lives are just a mess. But that age range, when you're trying to figure out who you are, when you're trying to figure out where you fit in, and you're just trying to figure out how to navigate the future that seems impossible and doesn't. I mean, it's just so ripe with suicidality, with depression, with feelings of overwhelm. Like if this is something that can really benefit them, I think that's huge.
Yeah. And I mean, again, as I mentioned, like I've given it to kids for procedures. We know it's a very, very safe medication.
Right.
And from an ER doctor standpoint, like I gave it in Afghanistan in a combat situation. And I trained that way in the Navy because it is such a safe medicine to give, because it doesn't knock your blood pressure. You don't stop breathing like you do on opiates. And so from a trauma mass casualty standpoint, it is so safe. And so that's why it's also so safe to give. And, you know, people talk about veterinary medicine.
I literally was like, why do I keep wanting to link it with horses?
Yeah, because people have, I think it was in the movie Armageddon, actually, which by the way, Soulless.
Wow.
I always cried in that movie. Oh, God, I can't. Yeah. Yeah. Apparently, where's the I'm squishy. So anyway, what's the point with that?
Horses, they always think veterinary.
Yeah, the horses, but
on that, it's safe.
yeah. Yeah. So, you know, when you're in this like chaotic environment and you're putting down big animals that are non-compliant, you know, you can use this, and it's no problem overdosing, you know, in a crash situation because it's so safe.
So you mentioned opioids. We all know opioid epidemic. Thank you.
Not quite. Epidemic.
I had demic. Correct. We all know how that, you know, obviously has played out. Is this something that people could become like overly attached to or addicted to or get
Habit forming.
right?
Yeah. Short answer, yes. Long answer is usually they don't get physically addicted like they do to opiates. It's a little different.
It's like mentally addicted to learning and becoming healthier and happier. Because I'm addicted to learning. I should not sit to ketamine. I'd be like, oh my God, my mind is open.
I don't know if it's quite like that. So it's more the dissociative, you know, like the escaping my life kind of a thing.
Yeah.
And there is a little bit of where the ketamine has a small affinity to some of the opiate receptors, but it doesn't work that way. So some people, the physical dependence is very low. But then again, it's being used as a treatment for alcoholism. So ketamine, I think it's at Oxford, actually. Celia Morgan is doing research on this as a treatment for alcoholism, seeing really good substance abuse improvement rates. So with the ketamine, yeah, like 6 months sobriety, at least that's how far out the data is.
Yeah, see, that's really kind of fresh. I mean, it's fresh.
Yeah.
But it's good, but it's fresh.
Yeah.
Because I'm like, oh, okay, did you... Because I had a niece and her husband, you know, they were addicted to, oh my God, what were they addicted to? I'm drawing a blank, but the response to get off that addiction was methadone. And then they were on methadone forever, but it was paid. So it was like, well, this is okay because I'm allowed to be on this. And the effects that it had on their family and their household, it wasn't any better than the drugs they were doing before.
Yeah.
They just didn't have to pay for the drugs anymore, you know?
And so it was like prescribed drug that replace the drug.
Exactly. Yeah. So my skepticism, my skeptical mind, which is very rare, but it's like, oh, how is it not like that?
It's just, yes, replacing one for the other.
Yeah.
Yeah. And that's a wonderful question. So when I give it IV, we're monitoring. I actually have this really cool like finger cuff, because that way we can kind of watch your blood pressure.
A little birdie.
It's like a little tiny cup. It's like the cutest little, and we can always watch you 100% be there so that people are properly monitored. And then going into your question about like long-term addiction,
Becoming addicted to that to get off of something else.
wow, most people don't end up. And the thing is, I was like Elon Musk recently was talking about this left and right. Because
yeah, I don't watch the news.
yeah, he tweeted 4 tweets. My brother loves Elon Musk, so I get a lot of things about him.
Yeah.
In general. Yeah, and most people talk about Joe Rogan with that.
So in terms of physical dependence, it's very low. And anyway, I give it IV. And so it's very hard for people to get that. Most people who want to get high will do something that I don't do, which is oral. Yeah, I mean, that's just the thing about all psychotropic drugs, is that if you can abuse it, someone will. Well, I mean, it's also like I've had the the hydration, like where they give you the water, like where they come to your house and with the vitamins and stuff in it. And I feel so much better, like for a few days after that. So, I wonder, having an IV, like it's not something I can obviously give to myself all the time. Yeah. It's not something I can afford all the time.
Right.
Yeah. So I wonder if it's perhaps something similar to that. I mean, the hope is that people feel better right away, start to implement lifestyle changes, and then with a proper coach, because that's what we want, is they're able to integrate this into a better lifestyle so that you can appreciate, what life has a lot to offer.
Right.
And that's where you should focus your efforts. And sometimes that means breaking old habits, like, the friend that is a bad influence, or like if you get a relationship. Yeah, exactly. So the hope is that through giving these medications, you slowly start to realize, okay, I'm feeling better. I can see my life more clearly, and improving from there, so that the addiction, because I've heard so many things about addiction where it's like you maybe you're running towards the drug because you're running away from something else. Childhood. Yeah.
Oh, so many times.
It's always childhood. It's always sad childhood. As according to Jamie, it's always childhood.
It always goes back. Like rehab, or the worst could be yesterday, but always goes back to childhood.
Right. And that's where, so I went to a workshop for ketamine psycho-assisted psychotherapy, where pharmacists, so I think this is getting to me. Yeah. Hi, girl. Around. Do you need more squirt? Just, okay, so what did you put? Wow. Ketamine? Oh, I mean, I forgot the lime juice. So instead of her mule having lime juice, it has squirt. So, yeah, maybe it's that little sugar. It's not sugar. Oh, it's sugar.
It's sugar-free.
Oh, never mind.
Bottle.
Oh, did it?
See, I go, oh, look.
Okay.
I'm just kidding.
Yeah.
I love that.
Oh. So we're just fun. So it's our fun. I'll do that more often. I'll just entice animating. I like it. I'll not hear. We had another meet. Do I? What's on me? Isn't that time? Yeah, it's nice. She definitely goes too. Do you want a tarot reading? I do. Oh, yes, please.
Let's do a lot of fun stuff together.
All the fun. I'm all about that.
Well, that's why a couple of ketamine clients worked with me. They wanted to do hypnosis in conjunction with it, because it was that dissociative state that they were in during the treatment.
Which is great because it relaxes your mind and it unlocks your subconscious. Yeah, hell yeah. That's my childhood trauma.
How life like healing. Talk to your subconscious to talk to the source of the problem. Rather than talk therapy, which is right here, we go back here with hypnosis.
The same place where depression is.
Right, where depression. Like, we bypass that because it's like, well, it's too much. Let's do it.
And you bypass the trauma responses that are defending.
Yeah.
Yes. So, yeah. So do you require somebody to have that support in order to access the services? And I know you're open. So, yes. Yeah, and that's where some of this, I really feel like I want someone to have someone to guide them after. Because, I'm a medical doctor. I'm not a therapist. And, I'll do the best I can to create the right set and setting and give every resource possible. Here's some intention guides, here's some this, but that's no substitute for a proper therapist, who can go through childhood trauma and, whether in session with the ketamine or even the next day, either one is great. So what I'm hoping also to offer is, as people are getting their treatment, just having them at that just right level, which again, I'm doing IV so I can titrate on just at that right level where they can still engage with someone. And, so that workshop, they were talking about a patient where the therapist was talking to her and she says, okay, it's like a dream, but you can talk through the dream. So like, okay, I'm at my childhood bus stop. And they're like, okay, so why are you at a childhood bus stop? And she's like, oh, I need to go home. Like, I'm being dropped off. and she didn't want to go home. Why? I went, right, exactly. So what they were able to do, what are you, yeah, what is your 6-year-old self telling you? So, but with this medicine, they were able to either work for you, and they were able to walk home, face everything. And, actually, when I did that, it almost makes them similar. This is why I love doing hypnosis with Jamie. I didn't want to train myself in hypnosis or get trained in hypnosis too much. She's my twin flame. She's got the skills that I don't need, right? I don't balance. Yeah, that's what we always joke. But I love that inhibition to explore life from the past and see it in a different way that is neutral. It's that neutrality. It's approaching it from a place of neutrality, even though you're still feeling it, right? But you're feeling it like a movie, which is such a different feeling than when you're remembering.
Because you're watching it, the pain, but it's simultaneous because it's your brain is, this front part of the brain we're talking about, it's still active. Yeah, it's awake and conscious, just like with ketamine treatment. So with clients, they're like, I see them at the bus stop, and they are neutral about it, but the front part of their brain is like, but I know I act in this scene, I'm actually terrified. So like your brain is having that dual experience of like, yeah, I'm watching myself walk home now, even though they're like, I also know terrified, but they're able to do it from neutral.
And it is like a dream, right? Where it's like, I can be first person. Yeah. I also can be floating above and watching it all. Yeah. So there's that, again, it's that, it's that separation of I'm experiencing and immersed, but I'm not, I also know that am not experiencing this right now.
Yeah, that's beautiful. That doing the simultaneous psychotherapy with ketamine treatment.
Yes, they're continuing doing that. Yeah,
that was magic.
That does sound magic. Oh, you want a therapist and a life coach? Me too. I'm also a therapist. Can I call myself a life coach now? Because
no, this is yes, and absolutely, and exactly what you're.
Do you need partners?
Yeah, no, we don't know. I'm all like this is like I'm just like bring all the people. Like I'm offering the medical service. The supervision, the safe set and setting, the proper monitoring, every hearing has a little part. I take care of, I gotta do that. Yeah, exactly. And that's, let's collaborate. Let's do that.
I just want to say really quick, every job I've ever had, having worked at Children's Hospital, the people that are the most respectful of my role as a social worker and a mental health practitioner have always been doctors. It's fascinating to me. Like in the ER, having doctors be like, oh, this is on you. You tell me what you want me to do with this kid who came in who is suicidal. Black in every other job, whether it was in a social work nonprofit or a school or wherever, it was like everybody's fighting with me like, well, what the fuck do you know type thing. They don't say that, but that's the attitude of like, and it's like, well, actually I know quite a bit, but fuck me, whatever. Oh God, I'm so sorry you experienced that. Oh, but doctors are so wonderful at recognizing this is where I stop, this is where I hand the baton to you, and vice versa. And it was, I don't know, it's so beautiful. Once I heard you say that, I was like, oh, that's such a nice, such a refreshing, like, let me do me and you do you. Like, I lead a team, like, there are so many things that like I'm good at. But I'm not good at everything. Like, come on, talk to a 5-year-old about insurance. That's yeah. But when it comes down to it, it's a bit like there's just I just want to surround everyone with care. Like I'm a piece, you're a piece, they're a piece. Like just surround, like to wrap our arms around all of our patients. And that. So
then, can you share the length of time? Because going back to antidepressants, typically it's for life. If you want to experience the lovely experiences of taking antidepressants, right? Mm-hmm. If you want to continue to live through life at the, less depressive state. So ketamine treatments, what does that look like for longevity?
Yeah, so that is also an awesome question. So each treatment's going to be 2 hours for depression. And really that's from when you walk in the clinic to when you walk out.
Okay.
The infusion itself is 40 minutes. And then as you go forward, sometimes people that first time, it hits them kind of hard. So you're kind of in there for like 60 minutes. I mean, obviously infusion ends, but you may be pretty out of it for 60 or so.
Like you're waiting for the effect to wear.
Yeah, it kind of wears off. And then we just kind of observe you for an hour or so afterwards, and just kind of, go into like not too much talking, but what did you get from that? And what I'm thinking of implementing is a kind of like next steps kind of card, or like, what did this experience mean to you? Is there a word you can use so that you can, in the following days, kind of take this experience forward? And then we just wash for an hour. And if there's want to do journaling or just sitting and drinking tea or just like chopping on some ice or something like that, just getting some space to just be. So, and by the way, I'm a huge meditator. So what I'm going to do is probably record a few meditation sessions so that people can meditate ahead of time. And I just, those get them in on my download list. Yeah. Yeah. So just, learn to, be with the breath, be with the body, work on awareness versus attention versus reactivity, responding. So anyway, I'm super deep into that. So, oh my God, I have you left so many.
But my crystals, we all know. It's like, I know, let's give you what you
I have my turquoise.
Yeah, I
know. So like I have so many thoughts only because, and obviously this is your vision, but I'm like, oh my God, what if you had a room for meditation and a room for therapy and a room for sound healing and a room for tarot and a room for, so that anybody can just kind of go into.
And you start here and then you make your way.
Or no, you just go to whatever feels right. Like you let the body just leads you. Oh, that's because let's go to business together. Let's open a nonprofit, right? I'm opening a nonprofit. Maybe what? Yeah, called Vera Monet. It's right now. I'm trying to do the final part. God, I mean, I'm not gonna lie. Every hoop you have to jump through to just open fucking anything. Actually, no, my LLC was super simple. It was like a form and the government, they don't care. Yeah. The nonprofit, holy shit. Like I have to already know like where I'm gonna dictate this percentage of my time and this percentage of my time and this percentage like of the time of the nonprofit. And I'm like, well, I don't have all of that figured out yet because I let life unfold as it unfolds.
They don't like your way of thinking.
No, they don't. They don't.
All I hearing.
They don't. And so, like, what is the broadest way that I can say something like, yes, we want to support mental health? 1,000 things can fall under that. But Renee's my mom's name. It means reborn. And she has schizophrenia and bipolar. And Virum is Latin for truth. So my hope is to show the world Renee's truth, my mom's truth. And then from there, the truth can be reborn within them because then they can start seeing people differently and not as the enemy and not as the demons that they think they are, but see the love and the intention and the gifts behind everything that they are truly capable of giving. So, yeah, you want nonprofit, you can join in on that shit. I don't know what the fuck I'm doing at the time.
We're not those. We're not a doctor.
I've got a lawyer, though, so yeah, I've got that going for me. She's great.
So you're going to have a meditation. You're going to potentially partner with Angie and have stations here. So then the treatment itself, start to finish, 2 hours. And then what happened?
Well, so we're going to start with like a foundation series. So like I said, 100 people come in, 80% respond, the other 20% just get a fun, like, sleepy time. Better nap ever. Yeah, but so of those 80%, 30%, all they need is 6, really. And that would be twice a week for 6 treatments. And then bye, see you later. Hopefully I'll just wait to you.
And that they were and then they're done.
That's it.
Like synapses were formed and depression symptoms.
Wait a minute.
Mm-hmm. Angie has questions.
Isn't a habit, don't you need 28 days to make a new habit? This is your brain.
I know. We don't even have enough research on the brain to really know how the brain works.
You're right. Yeah. The brain is. But it has 28 days because it's over 3 days.
I was like, spending 3 weeks.
Yeah. And also, I mean, so that's like, for 3 weeks. Twice a week. But if like, so say your PH2 scores are really high and then they start dropping.
You have to say what a PH2 is.
Yeah, like questionnaire.
And that's an questionnaire that gauges
Depression, related suicidality. Yeah, suicidality. Yeah. And it's funny because even if someone comes in suicidal, what's the treatment? What I'm about to give you.
Mm-hmm.
So it still comes down to like, okay, I would probably then call, and again, as an ER doctor, I know what to do.
Right.
Now, again, I am not an ER, but I kind of am a little like high strung in the way that I will be very prepared like an ER should anything happen. But it's good. I know. I was just like,
That training. See?
Yeah.
Full circle.
Yeah. Yeah. So again, that's why I think ER doctors are like amazing to start these kinds of clinics because we bridge not only procedural sedation, but also mental health. I love these. So yeah.
You loved it.
I did. I had children.
I worked in my jams too, but I love fly by the seat of your pants. I cried just like take on whatever they throw at me.
Yeah. That's why I couldn't do therapy in the same way that she's doing it because she wanted like the long. I'm like, I can't.
I would leave the Zoom and I would go up to doctors. I'd say, so do I need to go back in there? And they're like, no. And I'm like, but I just kind of want to ask them how they're doing. And I'm like, I want to call them later and see how, like, I can't let go. I have it. Yeah. So I just was like, I need the long-term care. This acute care doesn't make any sense to me. And I'm like,
I just let go 100%.
So good luck, you too. The acute care. I can respond to emergencies. But I also spread your wings, my love. Spread your wings.
Well, that's the thing is like some people like call me if you need me, you know? And then the other 60%, it's hard to say, but about 30, so like a third, about another third will need to be seen probably like once a week to once a month for about a year or so. And then the other last third is maybe ongoing for about 2 years. But depends on them. And that's why I want them to have someone to touch base with. So like, do we need to have another treatment?
Oh, so okay.
Yeah. Some people will come in for boosters every 6 months. It's very individual. So some people have a 6th and then a year later they need a booster, or 6 months later need a booster. But that's kind of just how it is. It depends on the person you never quite know. So how can you tell red flag wise if somebody's becoming too attached, or is that even a concern? Then I guess what would be the plan? To attach to the medicine? Well, okay. So I, as a mental health practitioner, meeting somebody who says, yep, I've seen the same therapist once a week for 4 years. I'm like, whoa, okay. That to me seems like a problem because you shouldn't have to. Like, if you are really working hard as a mental health practitioner, life coach, therapist, you're trying to push them out away from you. And yet it's like this attachment issue. Like they just don't know how to let go. Mm-hmm. So I guess I don't even know really kind of I just want to know like what would be your plan?
Are there ways that you can gauge? How can we tell? Like, you know what? You like PHQ-9, your numbers are pretty good. Like maybe you don't need this intense level. Like maybe you do need a titrator kind of like, is that a thing? Do you do that?
We do titrate, yeah, because in that foundation series, what was that word?
Titrate?
Oh, decrease. Ooh, or just adjust.
That's a funny word. Yeah, that people keep talking about in Ketamine, and I'm like, oh, okay.
I did not know that. I like that word.
Fun word.
Yeah. And that's the thing is like sometimes I'll have to titrate someone, like say their first one, so the dosage tends to be like very solid when the research, like it's always 0.5 mg per kg. Okay. And yeah, we know that sometimes we have to adjust accordingly up. For example, like there is a tiny bit of tolerance in those 6 weeks. So you might need to go up. And then if there's any history of alcoholism or benzodiazepine use where they're on like, Ativan a lot, it's like, well, let's try to minimize that. Just because it actually kind of gets in the way of the medicine. Anyway, your question was about getting attached. Yeah, so getting attached, that's where I really want to, again, create this like collaborative care model. Holistic, everybody's, yes, exactly. There's more eyes than just one.
Yeah, our service providers.
Absolutely. And I'm really hoping that when people come in to our clinic and call, we get medical records from their mental health professional, because that we can go through and, screen out like, oh, do you have a history of mania? Because that is one of the big risks. Is could this precipitate a manic episode? And my worry with that would almost be, I know a lot of people who they recognize depression, but they don't recognize mania. They recognize that as I'm feeling good.
Yeah.
Especially hypomania. You know, that's hard. Yeah, there's a lot of people where I'm like, you probably need a psychological evaluation to see if you have, because those of you listening at home, mania is the flip side of bipolar. So with bipolar, you have depression and you have mania. It can go anywhere from a hypomanic state, which is just kind of an elevated, like maybe over caffeinated, and
Hypomanic's a step down from manic.
right. So maybe just really creative or a lot of ideas or whatever. And then you get into manic, which is more of like taking that risk behavior, such as gambling and unprotected sex and staying up a lot and shopping. And then you can turn into fully having like psychotic mania with psychotic symptoms, which to me really resembles more like schizoaffective, like my mom. But anyhow, so the concern with mania, if you ask them and they say no, I guess what is the concern that could happen if they take this and they truly do maybe don't know?
Yeah. Well, that's where we would gauge that in the clinic, and that's why we're always monitoring. And again, I have experience with treating mania, experience with treating schizophrenia, and that's where we would get that intake ahead of time, very detailed, go through, are you a candidate or not, screening out the schizophrenic, screening out, are you having active mania? And then should they have a history of mania, really like, that's where I'd be like, ooh, let's talk to your psychiatrist about this. And if it's probably a few more waivers.
Yeah.
But so mania is not 100% exclusion. It's a lot more liability. It's highly, yeah. Well, and then are there rules, like you were kind of saying earlier, with other medications they can or cannot be on while doing ketamine treatment? They can be on just about anything, but there are certain medications that will minimize the benefit. Yes. Yeah. So lamictal and benzos are kind of some of the big ones. And most of like the SSRIs and the SNRIs totally be fine on those because it works completely different. This is an NMDA receptor antagonist, a fully different receptor. But like the benzos and the alcohol just minimizes the effects. So, I may be giving you 100% of the medicine, but your brain's only taking on like 80% if you've got those on board. So interesting. Okay. Oh yeah. So the long-term people, it's like 30% of that 80%. Yeah, like, and long-term is like maybe 2 years.
60% and we're total 100% either time.
Yeah. And and again, this is like impressive statistics. For how long?
I mean, honestly.
That's why it's like, I've even heard that perhaps this in the future, once we get more research and data and more acceptance in the medical community, it could literally be the first line treatment. Right? Yeah, like it should be. Right. With these statistics, I'd rather it be the first line than the medications, because as a therapist, the number of clients that I have where I'm like, I really don't know what else to tell you, go take these meds from this doctor, right? The hard part is so many of them, the side effects are not worth it. And then that's what keeps them in therapy almost for life, because they're just like, the side effects are just not worth it, because while yes, my depressive symptoms are like lightening up a little bit, this weight gain is outrageous. My libido is gone. And honestly, that's too important. And so I'm like, I get it. I can't tell you what to do and not do. And so I think that is the hard part with this.
Yeah.
So, I mean, I wish it would be the first line of treatment so we can let's just see. Yeah. Some people do need meds. True. But some people could also really benefit from ketamine. I think so. And I mean, these meds are what we've had for decades, right? So people who have been on them and frustrated. And I mean, even as doctors, this is all like those meds are the only tools we had to help people. So that's what we had to do. Mm-hmm. And there's all this research and data behind it for decades. But ketamine is so new to the scene that the research and data behind it isn't as robust. Mm-hmm. And also the thing is, it's a generic medicine, not a brand name. So that is why it did not make it the same. Aren't they supposed to be the same? I thought generic was just a cheaper version. It was like the store knockoff cereal to but there's no way for pharmaceutical companies to bill for a brand name ketamine because it's been so far out of patent for decades.
It lost its patent a long time ago. So insurance, and this is an off-label use for it because it's a new finding. It was kind of under our noses all this time. And so now that we found a new use for an old medicine, insurance now won't pay for this kind of medication, for this kind of treatment. So that's why it's like cost is now being this huge barrier to getting these meds, because it does require so much monitoring and a doctor present, or a CRNA or a PA or someone else who's authorized to give this. So that's kind of the issue, is like, well, why isn't everybody getting IV ketamine? It's because it requires constant attendance. So I literally had like 40 questions in the time frame that you guys were talking, and I forgot most of them. But the one, how did they figure it out? Oh, well, so actually, oh my God, I'm so glad you asked. So they were looking at depression and actually schizophrenia, and they were trying to figure out the like pathophysiology behind schizophrenia and where that even resides. That is such a fucking fascinating. Like, oh my God, that's very geeked out of a giant crystal. So yeah, seriously, John, still talking about this is fascinating, because him and those guys at Stanford trying to figure out on schizophrenia. Oh my God, can I give him my mom? I'm your guardian. Here you go. We're here to sign off on. Yeah, I signed off. Yeah. Well, because I just found her fascinating. Like the way she sees the world, the way she interacts with the world. Like, I'm like, I always kind of joke, and I'm like, maybe she is actually fighting Armageddon in another timeline, and we just think that she's insane. But she's really, she saved our lives. You know, being like, who the fuck knows? I don't know. Who knows? Like, maybe it's a hyper, connection. I don't know. Anyway, go ahead. We're just humans. We don't. Right. So they were trying to do research on schizophrenia and looking at the receptors, like of where schizophrenia works, where this works, and like, my God, I'm trying to remember exactly all of it. But, they were studying that, and they were theorizing that this ketamine, knowing there's an NMDA receptor antagonist, how it works in a completely different, like the more, the neocortex part of the brain where they think schizophrenia is. They were kind of sort of doing research there, and then they started finding this kind of stuff. So I'm trying to remember the exact specifics, but I know it started with studying schizophrenia, and then kind of doing these subdoses and finding out, like, wow, interestingly enough, people are reporting that incidentally, they're feeling better after these 0.5 mg per kg infusions. Like, that is very odd. And then it's funny when there's a, and that's why when you have smart people doing research, someone could have been like, oh, okay, don't think about that side effect. But then someone was like, oh, this is an interesting side effect. Someone said that they were suicidal, and now they were no longer suicidal because we gave this ketamine infusion. Let's dig into that. And they did. And here we are. This makes me want to go to Yale and do research. I have so many questions. So excited. I have all like the questions, and I love exploring, like, well, what is this? And I love seeing patterns. And that I just love how people discover things that are so beneficial. I like, that's amazing. Yeah, love it so much. Yeah, I mean, some of that came, I don't know if truly it came from that, but if you've heard of psilocybin and MDMA being so there was all of these, psychedelics being on the forefront of possibly treating many mental illnesses, and knowing that this was also a psychotropic medicine. I don't know if that's where some of that came from, but there is a lot of parallels between, honestly, psilocybin and ketamine. So, but ketamine works much quicker and faster versus psilocybin is a many hours thing. It's almost like it unlocks just the right door in the brain. And the whole likely. Yeah. Psilocybin unlocks way too many doors, and you're like, there's a scary clown. Oh my God. Yeah, that's too much. Yeah. When I about the dose, and I don't. No, it's just so. Yeah, and just thinking of acid trips, is that horror story? Yeah, and I mean, and those, he is looking at all of this. It really is all of these, because these things that used to be so, bastardized, and medicine really frowned upon it, and then the politics got behind shutting these down versus the medicine. And the medicine, and, granted, there were some, big Tim Leary people out there who gave some of these medicines a bad name, when in fact, when we look at the data and the science, it is so fascinating, and it has so much promise. So Yeah. We're looking forward to the FDA just revisiting some of this, because whatever works for people is what I want to do.
Yeah.
And if and I'm very scientific, very research and data driven, and doing it responsibly. So that's what I'm trying to do with the clinic that we're starting.
It's also the age of Aquarius, and now is the time to jump out and do off the cuff different things, because that's the shit what society society needs right now, is a new approach to this same old, because we can't keep going down the same cycles over and over and over and think we're going to get out of this rat race of life.
It's sanity.
I seriously,
keep doing the same thing. Yeah, replace these meds. That's so great, because medications are so frustrating as a clinician, because I'm like, I don't know what to do. I don't prescribe this stuff. I don't understand it. But I also see it's not working.
side effects.
Yeah.
Oh, side effects of ketamine? Yeah. Well, when you get the infusion, I mean, you come into the clinic, we're doing an IV. But then reportedly people have some issues sleeping. Sometimes like the dreams get kind of vivid afterwards. It's a sedative, so people are just a little like sleepy afterwards. And like a little like you take a little, you're waking up from Benadryl kind of a thing. It's kind of the sleepiness, but that only lasts about 1 hour, which is why we observe people in clinic for an hour.
So can they drive home?
No. They need to have a ride.
So it's like an outpatient treatment.
Yeah, I mean, we're doing procedural sedation.
Yeah.
Basically. So that's how medically we look at it, is you need a ride home. Just like if you were to have, any
Wisdom teeth pulled.
Yeah, your wisdom teeth pulled, a colonoscopy, something like that.
I said some funny shit after I got picked up after my wisdom teeth were pulled.
Everyone does. Any other long-term side effects?
Long-term? So there are a couple. The big one would be, and usually this is in high doses, is bladder irritation or is cystitis. Like incontinence, or no, it's like an irritation cystitis. So like like a pain irritation, almost feel like
UTI, but not quite.
Mm-hmm. Yeah. So the thing about that is it tends to be in people who have massive doses. And most of the data out there is in people who have been abusers for a long time.
Oh, so
abuser.
Yeah.
Abuser.
So kind of like liver problems when you are an alcoholic.
Yeah.
Yeah. Okay.
Yeah. And of course we do want to watch, labs, just make sure that baseline you're fairly healthy. Your blood pressure is controlled, because this ketamine does raise your blood pressure during the infusion. So that's why I'm doing the blood pressure monitoring.
Oh,
and do it. Yeah. So those are kind of the big ones.
Okay.
Long term.
So then, can you describe if, like, let's say listeners like, I have depression and I don't like my medications. Like, what is an ideal candidate for someone who could try ketamine treatment?
So the technical medical inclusion criteria is someone with treatment-resistant depression, where they have tried 2 different antidepressants with no response or minimal response or intolerance of side effects. So that's that. Now, this isn't just for depression. It's for OCD, it's for anxiety, for PTSD. And the big one, chronic pain. Although with chronic pain, like rheumatoid arthritis type thing. So that's a really big question. From what I've seen from the data, some of it is kind of here and there. It's mainly neuropathic pain, which rheumatoid arthritis doesn't quite qualify.
Mm-hmm.
But things like phantom limb pain is like 90% effective. So amputees. So I mean, again, as a veteran, I really want to. I'm contacting the VA. I was gonna say, I bet the VA. Yeah,
I don't know. I feel like they hardly ever really offer PTSD treatment for their veterans as well as they should. So I wasn't.
There are we're all trying our best.
I would love that. I think we'll always love it if they were to offer this. This would probably be huge, even just for every fucking veteran coming back in. Like, here, you got to do you got to do a few ketamine treatment, try it out just to give yourself a diet. Because one like the night you saw some crazy shit, so let's just get you back. Let's just get you acclimated.
Yeah,
it's like you're in space. Let's plunge you off and get you back in to
gravity.
Yeah.
Well, she's just feeling better, and it's like so PTSD is kind of the big one as well. So that's why Yeah. So, what else? Fibromyalgia is kind of 50-50, maybe 60-40. I feel like a lot of fibromyalgia is up here. So, and that's what that
Of
helps.
the people I've treated, I would agree.
It's very out here, but it's so somatic
Yeah, but it's coming out in
physical.
It's like it's telling the part of the brain that's feeling physical pain that you feel physical pain.
Right.
Here.
But it's all
These
mental and emotional.
Yeah.
Like not say all, but most.
Yeah.
Yeah.
And it's hard to piece out, right? Because like say you have chronic pain, that's depressing.
It is.
So it's really tough to be because again, like I also am in the Andrew Weil Integrative Medicine program. So you guys are talking about like integrative medicine, like holistic health. So that's what I'm actually literally getting board certified.
Ooh, congrats. That's exciting.
So I've been studying like Ayurvedic medicine, Chinese medicine.
So Dana Camp, our lovely numerologist. Oh, so she has the Thera Wellness Machine. Have you heard of that? Because that's it's all about frequencies and it's all about realigning your frequencies. And she literally, like in vials, I've done it for a while and I really like it. In vials, there's like certain the frequency attached to I'm just gonna say like chaos, or the frequency attached to eggs, or the frequency attached to childhood trauma. I don't know how these frequencies get in there, but your body like resonates with the ones that are an issue for your frequency, and then she can like I don't know. Again, this Thera it's ancient Chinese medicine, but it's a somehow it's able to realign those frequencies. And I can tell you, having used it, I don't know. I just sit there and just chit chat with her, and I can learn her.
Oh wow.
Wow, it's incredible.
Outcomes are happening.
Yeah,
That's great though.
yeah. So, where was I going with that? Integrative medicine. So I'm all about that as well. Like, so I've been trained Western medicine. I've been ND. But then again, like my medical school was Loyola, where the motto is we also treat the human spirit. So, when I was there, I learned a little bit of acupuncture. And, like you, I'm super skeptical. Like, acupuncture, like, no. And then when I was in the military, I actually learned something called battlefield acupuncture. And it's so awesome. Yeah, I actually did it in the ER on like Navy SEALs. You're like, holy shit, this works. Well, I mean, I'm just like, Navy SEALs and pilots, like Navy pilots and Marine Corps pilots would come into the ER with random pain, but they don't want to be, out of commission because they want to be operators. They don't want to be taken off the job.
Right.
Navy pilots can't be on anything pain related that affects the mind. And so they'd be their wits' end. And what can you offer me, doctor? And I'm like, acupuncture.
Yeah. And I was like, would use it.
Yeah. I was amazed when it worked.
So
yeah.
Easy. So you would do gift card.
And God, how much of that, like, I love looking at life path. Like, how much of that really just kind of propelled you into this direction to open a ketamine clinic where you're like, yep, doesn't make sense to a lot of people are fucking doing it, and it's awesome. We had to learn. That's so great. Yeah. If I told you the story of how I actually got into this, it's kind of insane. I was like, okay, God, I am hearing you tell me this that I need to do this because my path is this way. And basically, let's just say God is like, no, Leslie, you're doing this. And I was like, okay, I hear you. Okay, either I am. A gentle little nudge. Oh no, he knows that I'm a very stubborn person. It was like I'm meeting you in the head with a hammer and faced. So, yes, and it's funny how when you're just in alignment with your purpose, just things fall into place. They do, and that feels so right. Mm-hmm.
Yeah, and here I am with you guys.
Enjoying a lovely. I just got goosebumps all over my body. Yeah, I'm so excited. Because when we found out about you, I was like, I don't know anything really about anything to do with this, but yep, sure, let's. I like your name.
It sounds like I'm planning to use it. I need to know more because I don't know anything.
Yeah. So do they do the oral IV? Do they do the IV? Where did they go? Here in town? Okay. I know that there's 2 other clinics in town. And I'm so thankful for them doing what they're doing for the community. And like, it's just like more like that's one of my big goals is I believe in it so strongly that it's like, I don't care who is getting people better. Let's just get people better. So I'm so happy that you've had patients and clients like get better with it. So that's wonderful.
Yeah. It's so exciting. Oh my gosh.
That's exciting.
Are there any other things that you want to share about whether your clinic or about ketamine or in general things that we didn't ask about?
Oh, most people, their big concern is cost.
Oh, yeah.
Yeah. So that's one of the first questions we get, which is a very valid concern. And, we do have to keep the lights on and, pay for rent. So what we do offer, but we do understand, like, yes, we want to offer this for everyone. So I'm looking at a nonprofit for veterans. I have a very deep interest in that. So I'm looking at what, I can do for veterans, for first responders as a healthcare worker. So there will be special, I think we're going to have scholarships for those at a discount. But we also are going to do a financing. We're collaborating with a financing program, like Care Credit or something. Yeah, to help.
Because I did Care Credit when I had LASIK, and I mean it was nice because it was like $2,700, and I did not have that money. They've helped, having the ability to pay it off zero and less.
Yes, a year.
Yeah. Did I get it paid off? Did
you use a spreadsheet for that? I love spreadsheets.
Oh, no, I used the ADHD approach.
You just wing it.
I just was like, oh shit, they're telling me I owe a payment. Fuck. Yeah, I think that
they want their money.
They are angry. Actually, I started telling people sometimes, I'm like, listen, I'm gonna need you to call me. Like, you're welcome for keeping you employed. I need you to call me to tell me, like, hey, you got to pay this, and then I'll just pay you over the phone because I know my credit card number.
I realized that years ago.
Yeah, I got that down. But if you expect me to actually fill something out, put it in an envelope, put a stamp on it, write the address. Yeah, I do all in you. Oh my God, I get my lawn service requires me to do that. My sprinkler guy requires me to do that. Like, I can't do Venmo or I'm like this. What does this mean? Antiquated.
How old are they?
Yeah,
84.
Don't up to date. I literally called and yes, I literally called my sprinkler guy. I texted him and he didn't really respond
because he does a text message.
No, he does. But he didn't really respond. And I shit you not. Well, my husband was like, "Do you think we owe him money? Is that why he's not responding?" Because he will legit mail me one bill and then another bill, and I just kind of forget, or life happens. I don't get it to me, or I'll even have it ready to mail, and then somehow it gets thrown away. Like, I don't know. Mail is just mail. Mm-hmm. And I finally was like, "Fuck, probably." So I finally messaged him back, and I'm like, "Do I owe you money? If so, can you tell me how much? I will pay you. I will have cash for you when you come. I'll also make sure I have cash for your service that day. I'm so sorry." This is now the 4th time I've had to have this conversation with him. He just doesn't talk to me until I'm like, fuck, do I owe you money?
He needs to just learn.
I think he needs a...
Hi, they don't. Why?
You know what? Can we barter?
I know.
Instead of like a bit of a avoidant personality, non-confrontational. I know.
Her bill.
I was like, and I tell him all the time, I'm like, I just need you to be like, hey, pay this. Can you also have some sort of like easy payment, like Venmo or fucking PayPal? Like, I can't just rely on finding you in town and giving you a check or cash or expecting you to mail something.
How can you?
They don't, yeah. And so when he ends up coming over, I don't always know how much it's going to be. I don't just have cash lying around. And so I'm like, yeah, and I can't always write a check in that moment because it might bounce.
That's awkward.
That's super awkward. And you also don't want to be like, can you not cash this till Friday? Although I might be at that point. Yeah, but if they don't notice, they could still just post it on it. Don't cash until Friday. And then, absolutely. Yeah, that's kind of that. Like, I don't want to be like, hey, I'm terrible with money. I have ADHD. Actually, I'm not terrible with money. I'm getting better because I don't have any. Anyway, I'm sorry.
Oh my God.
God. I digress. Oh, look.
Yeah.
I love money.
I love you, Luke.
Jamie,
I don't leave mine first. Mine says, going to work would be easier if I stayed in bed for a living with an alarm clock.
Who put 6?
Gross. Oof. No one likes that. That's when I get up, though. Anywho. Okay. Well, I would say this if I had depression and 2 medications of antidepressants didn't work. So I would say, oh, okay, I need to go try some ketamine treatment. Yeah, it's hard to get out of bed when you have depression, even when your ding-a-ling's going off. Your ding-a-ling? I call it a ding-a-ling.
That sounds oddly sexual.
I totally would. I love calling it that. I just are in color. I know. Like, my husband was jailing goes in the morning too. He comes up fucking 5 a.m. This motherfucker doesn't get out of bed until 6 a.m. So it goes off every 5. Oh my God, I do that too. And I'm like, chair.
Is that an ADHD trait?
Yeah, because he does this too. He has ADHD. He is Angie, just in male form.
Okay.
So he's
Slowly.
as soon as when Flynn now. He's all right. So
My husband is her.
yeah. So if the ding-a-ling goes off, like, and you snooze for an hour straight, and it's the most obnoxious noise, but he doesn't wake up to it, of course. And he will wake up at 6 a.m. because he knows he has to leave the house by 6:04 to get to work on time. And then it's just aggressive running around the house.
Does he get out by 6:04?
He gets up. He needs to leave the house by 6. He leaves the house he gets to work on time every day.
I am more impressed
to Bennington.
with the fact that he can get all of his stuff on.
He makes a breakfast. He packs his lunch. Yep.
Not in 4 minutes. No fucking way.
Yeah. I'll time it in the morning because I'm up because he wakes me up then. I guarantee you.
I'm worried about a sympathetic nervous system if he gets out the door that fast.
I'll make a reel. And I won't even have to be in fast forward, but I'll be like, this is it.
Although I ain't do that. Maybe he has like a special ability where he can, like Piper from Charmed, where he can like slow down time.
No, he's late, but he's also knows to not get in trouble at work.
Does he speed?
These are probably good questions. These are all good questions. Well, since he leaves the house by 6, getting to Bennington by 6:30 is easy because there's no traffic. There's no driving.
Yeah, 6. You guys should just move to my neck of the woods. Then he can get there really fast.
No,
He can sleep in.
he would not. He would still set his ding-a-ling to go off at 5 a.m. And then I would still be like, Taylor, sorry.
But no, the 5-year-old would be like,
Didn't know what I'm up. But wait.
no way. You know, you should, here it is. You ready? Vulva.
Oh yeah, that's an inside joke. For our past listeners, if they've been listening.
If you've been listening from the beginning, you understand. There it is. Vulva. Oh, man. I didn't even realize I was like back off the camera. It's all right. All right. So you.
Oh. Well, so this is why I picked it. It has the, it says you melt me and with a wonderfully toasted marshmallow. It is a perfectly toasted marshmallow on some chocolate and the graham. And I'm a huge s'mores fan.
S'mores are delicious.
So, and then it got even better when I saw the other side. I'm all squishy. Like, yeah. So I don't know how we're going to wrap that around to me. Am I melting and squishy? I don't know.
You're in love with what you're doing, and you're all squishy inside with passion and desire to truly make an impact in people's lives.
What continues?
I'm good at connecting shit. I told you. I like finding the connection. I need to go to Yale. Yale, if you're listening.
On her way.
I am on my way.
Text her the direction, you know?
Yeah. If you want to research my mom or my brain, that would be fun. Tell me why I am the way I am. Okay, so just one cat short of being a crazy cat lady. And it has isn't this I feel like this gal,
She's that cartoon.
that cartoon gal with like the pink hair. On here it says Auntie Acid. Somebody can DM us and let us know, like, is that her name? Was that always her name? Because that seems like, of course she's the crazy cat lady. She's fucking Auntie Acid. And actually, here's my question. Does she actually have cats?
Oh.
Yes.
She's like, she just has a bunch of mugs and calls them her. Or just have more questions.
Maybe
You need to connect.
she has schizophrenia, in which case she should not use ketamine treatments.
It's help further research.
There's like connection.
Mm-hmm.
But if she's on acid for treating her depression, then she could easily just switch over to ketamine. No. Let's go.
She should study.
The doctor said no. The doctor says no.
Let's go with the medically accepted treatment.
Yeah. Stop the acid. Go to ketamine.
Yeah, I'm a favor of that. I know. Yeah.
That should be your slogan. Stop the acid. Use ketamine. Try ketamine instead.
This is why we didn't do sales and marketing. We're a really good social worker.
Maybe I'll hire you guys just at the fun.
I see what's happening.
Yeah, we'll do it. We'll get it.
Oh my God. Well, thank you guys so much for being a part of this. This was a good time. I had so much fun.
Yeah. You have to come back when your clinic opens. Oh, yeah, sure. You'll have like literal stats out in your like so what times. And yes, honestly, I would be intrigued. But yeah,
Have you come back in 6 months and then a year?
yeah,
And continue promoting this.
Yeah, I'm stealing your hat mug next time.
Heck yeah.
do you want it? I could get. So literally, like, do you want?
No, sadly, this is your town. Yeah. Oh, is it? You can also take that one home because here's what happens.
Use them in your clinic.
We get I find them at thrift stores because I like to have new ones. So I get them for like $1, $2. So then I don't feel bad.
We have totes of them.
I have insane totes. We do have them for sale on our website. Should anyone want to purchase them?
So
Yeah. Please. The vulva on for sale.
oh, it's just for us.
That's just for our.
Yeah. Some good money is out this podcast, so we'll make them and sell to you, listeners. So buy our mug. I'm fucking selling you some coasters.
Yeah, buy our mug so we can sell you vulva coasters.
That's all we're gonna sell. I don't know. And I'm gonna
Just vulva mugs, vulva coasters, vulva headers. Who doesn't want?
what is this? Well, it's the Shrew Show podcast, but
Is that the gynecologist? No. The Shrink Show.
No, shove the butt in here.
lots of jokes.
Oh, yeah.
I love it.
Thank you so much. We love you. Don't forget to like, share, subscribe, do all the things. DM us, give us your feedback, your ideas. We're so thankful for everybody who already has. And we just want you to love life. So thank you for being here. Bye.
If you think we're cool,
Or even if you don't,
please like or subscribe so you'll stay up to date on all things The Shrink Show.
thank you for choosing to spend a portion of your life with us. And remember, don't take yourself too seriously. Life is all a giant shrink show.
A Huda Media Production.
Side effects of listening to this podcast may include side aches or snorting from laughter, impromptu jazz hands, nodding in agreement even though you might be listening alone, an occasional "you said it, girl," and mild cases of existential dread. This podcast is strictly for entertainment and informative purposes only and is not intended or implied to diagnose, treat, or otherwise substitute for professional mental health, medical, legal, or other advice. Thank you. Unicorn says bye.